just walking in, so Dr. Oz, if you're ready.
Wait a couple minutes. You what?
Well, I'm no Tony.
There's always got to be a little patience with technological advancements. So I think it'll be worth the couple seconds. Relax, Elliot, it'll all come together. Tenure, you guys wait. Okay, well, good morning, everybody. Thanks for joining us here today. We're really excited about the conversation we're going to have, and want to thank Dr. Oz for being on. Good morning, Dr. Oz. Dr. Oz is the administrator for the Centers of Medicare and Medicaid Services, and joined with CEO Steve Corse from the Department of Health and Human Services, along with Shannon Gertrain, and we're really excited. We're really excited to be able to announce today that we, the incredible people in state of Nebraska, are the first state in the nation to begin implementing work requirements that are passed in the big, beautiful bill. I think that, this isn't governor speak, right? I'm guilty. I absolutely love this place. I love the people, but maybe didn't recognize the invasion of poverty across our great state. It's really difficult to acknowledge the challenges people have in lots of places where we struggle every day. So I'm a big time believer that we need to lift people up and give them opportunities and help them find incredible ways to live daily, work in community, and raise their families and have an incredible purpose in life. So starting this next year, states will have to implement new work requirements for Medicaid expansion enrollees, and we, the state of Nebraska, is prepared to be at the forefront of making that happen. I think what's important in this conversation is that the requirement simply applies to able-bodied people to work. And what does that mean? That just simply means that anybody that's going to be a Medicaid recipient, that they are going to work, or they're going to be going to school, they're going to be improving their skill sets. They're going to have to spend at least 80 hours a month in order to maintain the Medicaid coverage, unless they qualify for an exemption. From my seat, it's really important. This is a hand up, not a handout. I think it's also important for all of us how rewarding work is. It's a key piece of giving the discipline for our families to be successful. It's a key piece of self-worth. It's a key piece of mental health and stability. I think that the other thing that's really important to recognize in the state of Nebraska, we have over 100,000 job openings, jobs that can't be filled because we don't have enough people. So there's incredible opportunities for every person who is wanting Medicaid that is able-bodied to work and will work really, really hard. It's important that we help people pursue a career, whether they go to school and so we can give back to communities. It all makes an incredible difference, and it's most importantly for our kids. It's really important for our kids to see people in their household working, fulfilling the American dream. And I think that there's no place. So we're really, really excited to be able to say that we will be implementing this May 1st of 26. We'll be the first state in the United States of America, and we're going to be working with Dr. Oz and his team to do that. And we'll be well in advance of the federally mandated deadline. Certainly appreciate President Trump and his whole administration for delivering this key reform. It's been tried in Nebraska. We're excited to be able to be the first to make it happen. And Dr. Oz, I want to thank you for being here today. Thank you for your friendship, your love of the people in Nebraska, and being with us. And so, Dr. Oz, I'd like to turn it over to you. Thank you for taking time to be with us.
Governor Pillen, thank you very much for your bold leadership. Let me just echo a few of your comments and then make a commitment to you and Nebraskans. First off, it is mission critical for us to appreciate that all great people take care of their most vulnerable. We're a great nation. We will do just that. As you walk into this building where I'm sitting, right opposite the Capitol, it's called the Hubert Humphrey Building, and Hubert Humphrey was from Minnesota, senator, ran for president, was vice president. So, you know, he knew a lot about how to deal with all types of problems that the federal government faces. And he has a wonderful quote at the entryway that says, "It is the moral obligation of government to take care of those at the dawn of their life, those are the children, those at the twilight of life, the seniors, the elderly, and those who are living in the shadows." That's who Medicaid was created for 60 years ago. We have to protect those populations. When you bring able-bodied individuals into the system, you begin to change the dynamic, the arrangement that we have amongst ourselves as a people. And in addition, we start to create incentives for people who probably wouldn't want to work, but have lost the pathway to get there, to want to do just that. And so it is our obligation, I think, as a great nation, to help people, because for the able-bodied individuals on Medicaid, for the working, but not working enough to get on commercial insurance, those folks actually want a handout. They don't want a handout, they want a hand up. Most people who are able-bodied on Medicaid actually are trying to get a job, but they, for whatever reason, haven't gotten to the finish line. What you're doing so boldly with this action, being the first state in the country to use this legislation as an opportunity to create community engagement, is going to prevent generational poverty in Nebraska. It's going to allow people to find pathways, because we're going to make it easier for them to do the right thing when it comes to try to find work. You gave the numbers in Nebraska, let me share them nationwide. We believe there's twice as many jobs available in the country as people who've applied to do them. So there actually is work to do. We just got to connect the people who are struggling to find their way with the job opportunities that can allow them to get back on their feet and get back into full employment. Again, the job is not to keep them at the poverty level, it's to get them so much better than that in their income that they can buy commercial insurance or use the HCA program. So by being the first state to institute community engagement, there's other things we should commit back to you. And again, I'm proud of what you've done. I'm sure that everyone in the state is as well. And others are going to look to you as an example. I highlight that. When you go first, you know, you go harder, but everyone's behind you. They can draft off you and benefit from your work. So CMS, the team I work with here, will work hand in hand with you to ensure proper implementation. We'll work hand in hand with you to ensure proper implementation. And we are laser focused on this process. We're also going to learn from you. We were humble enough to say that as you figure out different ways of making sure it's easy for people who are close to working enough hours or donating enough time or participating in educational opportunities that get to the 20 hours a week, that as you figure out how to do that, we're going to learn just-in-time implementation with you for these community engagement requirements. And I also think about implementation in two dimensions, and this is important for everyone to appreciate. The first is, you know, how are we going to address important issues like the exemptions, right? Who gets to get through to get free health insurance, which is a great gift, and because they haven't been well adjudicated. So if you've got a problem that puts you in those three categories Stephen Humphrey spoke about, children, 53% of them are on Medicaid or CHIP, they should get coverage. Elderly, likewise, and folks living in the shadows with disabilities and the like. And how similar are these to the SNAP work requirements? That's sort of the policy decision element of this. We spent a lot of time, we started the day the bill was signed, July 4th, working on the policies. What are the rules of engagement so everyone knows that? How do we take care of people who, whatever reason, have failed to get to those numbers, and so take care of them? The second part is technology. And this is the exciting part for me, because when this has been tried in the past without adequate technology, it's all paper, it's a lot of effort. You got to go back and scrounge up tax returns and other documents. Instead, how will states be able to check compliance by utilizing technology and already existing data sources? And just importantly, how do Medicaid beneficiaries engage? So we can actually experiment and figure out ways for this to happen expeditiously. We're connecting these individuals on Medicaid who want Medicaid, free insurance, with options around jobs, education, volunteering. So give you a concrete example. You've worked 17 hours as a gig economy worker driving a car. Now, how do we get you to 20 hours? We know you drive. We should connect you to the health employment, to the job office of the state. In Nebraska, you have a great one. Connect you to a way that you might be able to find extra jobs that maybe drivers want to do, because we know you drive because you have an Uber deal. And likewise, how do we get you educated and sign you up for the type of training that might actually make you that much more attractive in the job market? And finally, how do we keep track of things like volunteering? So we're asking states to tell us what is their current state capacity, the system capacity for Medicaid eligibility, the kinds of things you're going to be learning about and be ahead of the game on. And what do we do about enrollment? What additional functionality is needed to implement these community engagement requirements? We also want to know what data sources we need to verify community engagement so we can actually meet the criteria set by Congress. And what are the operational changes? What are the interagency agreements? Who has to work with who? How does the employment office work with the Medicaid office to make sure that it's seamless opportunity for Nebraskans? And with all this knowledge of state needs, we're going to be able to do a better job supporting you. We're already working on contracts with vendors, listing them federally, making it easier for states to use your procurement process. But all of this is accelerated because someone like you was brave enough to go first. So I want to applaud you, Governor Pillen, on behalf of the President, the entire administration, for taking on this massive opportunity to rethink the deal we have with America. And I'll leave you with one fact that might come in handy. If we can get the average American who's in the working environment right now to just work one more year because they love their job, because they're healthy enough to do their job, because they feel vital, engaged in life, that's worth trillions of dollars to the U.S. economy. So don't think about Medicaid as an expense. Think about how much benefit to our country if we can get people, help them up, give them a hand up into the workforce so they can begin to participate with the most valuable asset this country has, our most important resource, the American people. So as CMS administrators, this is a priority of mine. I treasure your commitment to it as well. I also appreciate our friendship, and I wish you and everyone in Nebraska happy New Year, Merry Christmas, and happy holidays.
Well, thank you, Dr. Oz. You just took the words out of my mouth. You know, in Nebraska, I say it all the time, the thing we love the most, anybody that moves here, they can't get it out fast enough, it's the people. And why we're so excited about this, we've got great people to help, but most importantly, as we raise this awareness, neighbors help neighbors in Nebraska. So we're really excited to work with you and grateful for all your help and all that you do. If you got a couple minutes, I'd like you to be able to hear our Director of Health and Human Services, Steve Coursey. You know, as governor, when you build your team and you ask somebody to come on board and disrupt their lives, move their families, it's very humbling and incredibly, incredibly blessed that Steve Coursey said yes, and he's going to lead the way of the Nebraska way. We're really, really proud of you and grateful for everybody at the Department of Health and Human Services. Steve, congratulations and thank you.
Thank you, Governor. Thank you. Gosh, after, by the way, I would move again for you. Absolutely. Anytime. Yes, sir. After Governor Pillen and Dr. Oz, I just commented to Shannon, I said, I don't even need to say anything at this point. So, but I will. I have some remarks, and I want to walk you through some information that I think Dr. Oz covered, a number of them, and the governor covered a number of the others, but just want to walk you through some of that. But before I say that, I want to thank you, Governor, for your leadership on this issue. I want to thank Administrator Oz and the Trump administration for their commitment to reform and to helping Nebraska, DHHS, and our goal of helping people live better lives. Helping Nebraskans move towards self-sufficiency and independence will certainly improve their lives and the lives of their children. Mr. Governor, to build on your comments about President Trump, and as I'm sure Dr. Oz will attest to, I recently spoke with a senior Trump administration official who shared that it's not unusual at all to receive phone calls from the president late at night or early in the morning, testament to his hands-on leadership and work ethic. And I can say the same about Governor Pillen, as that official.
Not 1 in the morning.
not one in the morning. However, I can tell you that many of my conversations with Governor Pillen have either been early in the morning, late in the evening, or on the weekends when he has called and said, hey, Steve, I was thinking about what can we do to improve this? What can we do to make this better? So thank you for that leadership, Governor. When this bill was passed and DHHS first discussed implementation with the governor, his response was immediate and it was clear. There was no equivocating. It was, we need to do this yesterday. And we've been working hard on it ever since to get ready for that. Under the governor's direction, DHHS, and particularly the Medicaid team, led by Director Drew Goncharowski, who isn't here today due to a family obligation, and Director Shannon Grotrian with the Office of Economic Assistance, immediately began working with our federal partners under Dr. Oz at the Centers for Medicare and Medicaid Services to obtain state authority to implement these reforms. So again, thanks to the governor's strong support, we're going to be the first state to obtain state authority from CMS. We'll be the first state to implement these reforms, and we'll be the first state to realize the benefits of this important policy change. We're initiating the implementation of work requirements by May to ensure that we're ready for the start date by the beginning of next year as laid out in H.R. 1 or OB cubed, whatever you like to call the one big beautiful bill. So in an effort to answer some questions that you may already be thinking about, I'd like to walk you through a few of the program details. There are 7 that I'm going to walk you through. Number 1, these rule changes apply to able-bodied adults ages 19 to 64 in the Medicaid expansion population. Number 2, Medicaid expansion includes individuals ages 19 to 64 with low incomes who receive health coverage through Nebraska Medicaid. Number 3, eligibility is based on income up to 138% of the federal poverty level. In 2025, for a single individual, that level is $21,610. And for a family of 4, that would be $44,380. Number 4, work requirement activities are requirements that Medicaid expansion members and applicants must meet in order to receive and maintain coverage through Nebraska Medicaid. Number 5, qualifying work requirement activities include, and the governor and Dr. Oz touched on all of these at some point, but I'll run you back through the 4. They are employment, attendance at school or participation in an apprenticeship, participation in an approved work program, like those we have at the Department of Labor, and thank you for calling them out, Dr. Oz. They are fantastic and great partners. And the 4th one is volunteering. And then 6th is members and applicants must complete at least 80 hours per month, which may be met through one of those 4 or a combination of qualifying activities. And then finally, that Nebraska will begin enforcing the work requirements starting May 1st. As a clinician, which many of you know that I am, I can personally affirm the benefits of work requirements. I've seen the benefits firsthand in my practice. There are physical benefits that include increased activity levels, more structured routines, and improved overall health, which fits with MAHA and the governor's focus on improving the health of Nebraskans. There are mental benefits that include a greater sense of purpose and accomplishment, enhanced cognitive functioning, and reduced stress due to increased financial stability and decreased levels of various mood disorders. There are also emotional benefits. Those include, and certainly aren't limited to, increased social interaction, reduced isolation, and opportunities for personal growth. In short, work requirements foster purpose, stability, resilience, and long-term security for individuals, families, and communities. Governor Pillen, thank you again for your leadership and for making Nebraska the first state to implement this critical reform.
Thank you,
Yes,
Steve.
sir.
Thanks for all you do.
Yes, sir.
And I want to give a shout out to the senators who are behind me. Many have got up really early in the morning to be here to be supportive, and I'm really, really grateful for it and for all that you do. Maybe with that, I want to say a gigantic thank you, Dr. Oz, for you answering the call and for you being here today. And you have a Merry Christmas and a Happy New Year. God bless. Thank you.
God bless you.
Open up for media question. Oh, I'm sorry. Thank you. We have the letter that I will sign to make it official. That is to Dr. Oz's administration that is enacting the mandate of the big, beautiful bill. So we'll make it technically official by the signing. Thank you. Happy to take any questions. Yes, sir. Juan?
I guess just have you, what's the expected, how many people are expected to lose coverage from these requirements?
Yeah, right now, today, that number, we think we can have a gigantic impact in helping lift people up, over 30,000 Nebraskans. It's a big number. Yes.
How much will it cost the state to administer and monitor these requirements?
You know, the way I look at running government like a business, when we do this work, there'll be other things that, so we won't be adding workforce. We'll be making it happen, and there'll be a few things, you know, this is a high value, so it won't increase the cost of running government. We'll make this happen within our business. Yes, sir.
There's been concerns about the reporting requirements for the individual being burdensome. Could you maybe walk us through what it's actually going to look like if I'm somebody who is, receiving Medicaid and reporting to the state activities?
Yeah, I'll ask Steve to go through the detail. Big picture from my perspective just simply is if a person is working poor and on Medicaid, we're going to help the people. What we're wanting to make sure we do is that who's on Medicaid and not working and they're able-bodied, we want to lift them up and help them understand and be a part of our economy, and lift them up and become better people.
I don't know that I even need to add to that,
Okay.
but I will really quick. So your question was specific to reporting requirements. I think the way to answer that is that we are currently using all of our technological, or looking at technology and existing resources and building a blueprint for that. CMS continues to make adjustments as we go along, and remember that we have until May to tighten everything up. So we're working with CMS closely, and we'll continue to do that as they figure out ways to manage, I guess, the reporting of that. Yes, sir.
Department of Labor will be a part of that as well. Yes.
Can you talk about some of the specific role-out efforts? I know you mentioned aspects of new technology that you're exploring. Are there any ways you're contacting Medicaid beneficiaries? Can you go into more specifics about what that role-out is actually going to look like?
Yeah, so the question is maybe more specifics about how we will be communicating with the Medicaid population. Steve?
So thank you for the question. Thank you, Governor. 70,000 people will be receiving notice. Goes out January 1st, right, Shannon? Or by January 1st, I stand corrected. 70,000 people, they'll be getting notice by mail, by phone, and by text, correct? Did I get them all? And we'll also be posting those notices on our websites and other places to make sure that everybody is fully aware of the requirements. Yes, ma'am.
Yes, sir.
What exemptions do you expect for caregivers who are taking care of an elderly relative or a younger relative with disabilities? How many hours will that count toward the exemption?
Shannon?
So the question is, I guess I'll repeat that, about caregiver exemptions. So like Dr. Corsi and Governor Pillen said, this is for able-bodied individuals, and there are a list of exemptions, and I can go through those with you. But if they're exempt, they don't have to meet the 20-hour-a-week or 80-hour-a-month requirement. Those are people who are disabled, people who are currently in foster care, people through age of 25 who have aged out of foster care, people who are members of recognized Native American tribes, women who are pregnant, parents or caregivers of children up to age 13, caregivers of an individual with disabilities, disabled veterans with a total disability status, people who are considered medically frail, people compliant with work requirements under the SNAP or the TANF program, people receiving treatment for a substance abuse disorder, people who are incarcerated or have been within the last 90 days, and people who qualify for Medicare Part A or Part B.
Caregivers of elderly would not be on that one?
So caregivers of elderly, if they are considered disabled.
How often do you plan to check the work requirements?
So we are working with CMS on those details, and I do want to mention too, there's a website that we're going to launch today that's going to have frequently asked questions that we will be adding to as we work through this partnership with CMS and the Department of Labor. Sorry.
Maybe I'll add, but I'm inclined. I want to share something to put things into perspective of what we're trying to do. I had an extraordinary moment being your governor yesterday in Madison, Nebraska. Man by the name of Ray Krings served in the Vietnam War. Ray was severely wounded, 1969, double amputee because of his wounds. Thankful that he survived. Ray Krings is the epitome of standing up with no lower limbs. And he came home and married his high school bride, had 7 children, and he farmed his entire career as a double amputee. Never once asked anybody for anything from government, not once. That's the epitome of what this process, what we're trying to do, is create more Ray Kringses. And I had the extraordinary privilege to give him his Purple Heart that somebody laid beside his bed, and thank about 125 Vietnam veterans for their incredible sacrifice. But today's another celebration of Ray Krings, if you will. Your question.
What ways will you work to make it easier for these able-bodied people to find jobs, as Dr. Oz had suggested?
Say the question one more time.
Dr. Oz mentioned, and I believe you mentioned as well, making it easier for these able-bodied people to find jobs, especially in a state that has fairly low unemployment. What avenues are you hoping to take with that?
Well, I think that the question is, what can the state do to help able-bodied people find more work? I think that as we make this forward and say, look, people are not going to be able to live off of government if you're able-bodied. That's going to help all of our communities understand. I'm a believer that business leaders, farmers, and ranchers in our communities can solve most of our problems. So I think once we get that out, a lot of people will understand there's more opportunity, number one. And then number two, I think that between Shannon and Director Corsi's teams, and then also the Department of Labor, there'll be a lot of reach out, and I would imagine we'll probably even be engaged with Department of Economic Development to help with the messaging of it.
Yes, sir.
Okay? Yes, sir.
You said this would be existing workforce, you're not adding any staff. What specific teams or staff members will be doing this work?
Shannon?
So in the Office of Economic Assistance, we have eligibility staff that determine eligibility for both Medicaid and economic assistance. So in partnership with the Division of Medicaid, we'll be working together to roll out these requirements.
Okay. Well, thank you. One last question.
One more, sorry.
Okay, that's all right.
There's concerns about reporting, paperwork, compliance issues in other states as well. What safeguards are in place to ensure that Nebraskans that are eligible don't lose coverage because of those issues?
I think that when you listen to what Director Corsi talked about, that there's a lot of procedures and processes in place that, you know, we're going to err on the side of people's welfare. Hey, it's our responsibility to take care of those less fortunate. We'll err on that. We're not out here to take everybody to the curb. We're just here to try to create more Ray Kringses so everybody understands the privilege of working and making sure we get every able-bodied Nebraskan to be a part of our community. Thank you all for being here. Have a great day. Merry Christmas. Happy New Year. Thank you.